In this video, we'll discuss about normal range of laboratory test or reference interval or a reference value or reference range. When we take a laboratory examination, we receive a report with some numbers for qualitative parameters, but these numbers are normal or abnormal. These numbers should be compared with a normal value, but where come from this amount? So when we are taking laboratory examination, we receive some report, but that number are normal or abnormal. We should compare with the normal value, but question is where come from this amount? From NCCLS, National Committee for Clinical Laboratory Stand, recommend to choose at least 160 samples, and some specialists recommended at least 200 samples. So from where we get that amount? From National Committee for Clinical Laboratory Stands or some specialist. This NCCLS recommended at least 160 samples. Specialist recommended 200 samples. 200 samples of healthy people for determination of normal range. It is very important to condition as the same as routine laboratory method. Result divided into a chart, and the region that 95% of result are situated expected as the normal range. 95% expect as a normal range, and it is also called as a reference interval or reference value or reference range. These are some factors should be considered for determination of normal range, such as sex and age. For example, hemoglobin and hematocrit in male and female are different. Testosterone related to age and sex is different. The test time. Some interval factors have a daily cycle, therefore it is very important to do it in an extract time, and the normal range defined as this time. For example, cortisol should be examined at 8 a.m. or 4 p.m. Next, disease space. Normal range of some internal factors defined as a force of disease. For example, hemoglobin A1C. To determine the blood glucose level in last 3 months in diabetes, defined as normal people, pre-diabetic or diabetic or good control. There is some other factors should be considered in interpretation of the test result, such as race of community, geographical area, and therefore the effect of the temperature, sea level, barometric pressure, humidity, and time zone. Interpretation of test result should be done by a physician, because Other factors must also be considered, such as clinical examination result of other diagnostic methods such as radiography, sonography, CT scan, MRI scan, and others. Family history of a hereditary disease and medication, amount of using drugs, and interaction between drugs. So, in this video we discussed the normal range of laboratory test or reference interval. Who determine two factors, NCCL and some specialist. Nearly 95% is similar to normal range. Then what are the factors will determine? Sex and age. Then test timing, either morning or evening. Then disease phase. Then other factors. Then results should be done by a physician. What are the clinical examination? Radiography, sonography, CT scan, MRI scan. Thanks for watching.